Hello, online students. I'm going to be recording for you some more of the head to toe assessment and what's expected. If you'll get out your syllabus so you can go along with me, we're going to be going over the mouth and the neck in this segment, which is Roman numeral 8 and 9. So we're getting closer to the end. So we're going to go over 8 and 9. So I will pull that up now and we'll get started so I can tell you what to expect on your checkoffs. Okay. If you look on the mouth, that's where we're at. This section's worth 10 points. And the first thing it says that you're going to do is inspect the lips. And this is on page 362. You're inspecting the lips for color, moisture, cracking, or lesions. And you will retract the lips and note the inner surface as well as on page 362. So you would go in, you'd say, I'm going to look at your lips. I'm looking at the color of your lips. I'm looking for moisture. There's no cracking. There's no lesions noted. Then you're going to look in the mouth and you're going to make sure and to inspect the internal mouth. And you're going to look at the mucosa, the teeth, the tongue, the palates, the tonsils, the salivary glands, and the uvula. So what you're going to do is first start with the teeth and gums. So you're going to, and this is on page 362, you're going to inspect the teeth. You're going to see if there's any diseased, absent, loose, or malpositioned teeth. Usually they should be white, straight, and even. Compare the number of teeth with the expected number for their age. Then you're going to look at the tongue, and you're going to look at the tongue for color, any surface characteristic changes, and moisture. The color should be pink and even. The dorsal surface is normal with roughened, and it's kind of rough from the papilla. A thin white coating may or may not be present. Ask the person to touch the roof of their mouth so you can see under the tongue as well. You should be able to see that it's very moist and that saliva is present. Okay, so it should be just a pink and even tongue. If you're seeing a real beefy, swollen red tongue, usually that indicates some abnormalities, or a real dry tongue. So they should have saliva present as well. So you're going to go in, you're going to look at the lips, you're going to inspect them for color, moisture, cracking, and lesions. I see none. They're moist and pink. Red. Then I'm going to the teeth and the gums. They are white. They're straight, evenly spaced, clean of debris and decay. No problems with the teeth. As I'm looking at the tongue, I'm looking at the surface characteristics and moisture. I see that it's pink and even. I see that there is adequate saliva and no deformities of the tongue are noted. Then, of course, when you get ready to start the mouth, if you did not have gloves on before you started inspecting the mouth, at this point you need gloves. So with the gloved hand, you're going to take the actual tongue with some kind of cotton gauze pad and retract both sides of the tongue. And you're inspecting for any white patches or lesions, because this is one of the early indications of cancer. So you'll look on both sides of the tongue, then you will actually take your finger and palpate under the tongue to make sure there's no lesions. And you will have to do this on your assessment. So you would inspect. I see no white patches. I feel no nodules or lesions under the tongue. And again, always wear your gloves. Then you would look at the buccal mucosa. As you're inspecting it, you can also look at the Stenson's duct, but you would have a tongue blade and you would look on both sides for color, nodules, and lesions. The Stenson's duct is the opening of the parotid salivary gland. It kind of looks like a very small indentation or dimple opposite the upper second molar. So you go the upper second molar, go across from it in the buccal mucosa, and you should see a small indented area. You're again making sure there's no white patches or anything of that sort that could indicate abnormalities or any inflammation of the Stenson's duct. So the buccal mucosa should be pink and moist, smooth. The Stenson's duct should appear as a small dimple with no lesions, masses, or redness noted. Then you're going to look at the hard and soft palate. You're going to shine your light up to the roof of the mouth. The more anterior hard palate should be white with irregular rugae. So you're going to first look at the anterior palate, the hard palate should be white with irregular rugae. The posterior or soft palate is pinker, smooth, so it should be pink and smooth. A normal variation, there is a nodular bony ridge down the middle of the hard palate as well that you will see. But again, that's how you would say that. They are intact, and with the anterior hard palate being being white with irregular rugae, and the posterior being pink and smooth. Then you're going, starting on page 366, you're going to look at the tonsils and observe the uvula. So you're going to observe the uvula. Normally it's fleshy, hanging in the midline. So you're going to ask the person to say ah as you take the pen light back there. And note that the soft palate and uvula rise to the midline. So I would have them say ah and say the uvula rises to the midline. Then inspecting the actual throat, you're going to look on the back of the throat. You're mainly going to be looking at the tonsils. And as you look at the tonsils, you're going to grade the tonsils. If you look on page 366, it tells you how to grade those. +1 visible, +2 halfway between the tonsillar pillars and the uvula. 3 if they are touching the uvula, and 4 if they are touching each other. It says normally you're going to see 1 to 2 plus in healthy people, especially children. So normal is 1 to 2 plus, where they're just barely visible or they're halfway between the pillars and the uvula. So then you would grade the tonsils and tell if there's any exudate or anything present. And if they've had their tonsils removed at this point is when you would say that as well. Then you would check, you would have them clench their teeth down. That is checking cranial nerve number 5, trigeminal. And it talks about the cranial nerves back on 634. Again, you can do the cranial nerves all together at the very beginning as they are outlined in this chapter, or you can do them throughout your assessment. But for checking for cranial nerve number 5, you have to do motor and sensory function. So you assess the muscles of the mastoid by palpating the temporal muscles as they clench their teeth. So have them clench their teeth. And then you would do the sensory function. You would have them close their eyes, and you would take a cotton ball and touch their face and say, tell me now when you feel it. Okay? So that's how you check for cranial nerve number 5, and you would say that it was intact. Then you check the gag reflex, but I'm not going to have you do that. You can just say, I would check the gag reflex at this time. Make sure they can swallow. Have them try to swallow and say cranial nerve number 9 and 10 is intact. Also for cranial nerve number 9 and 10, again, you can have them stick out their tongue and say, ah, and again, the uvula should rise to midline, and that also assesses for this cranial nerve. Cranial nerve is number 7, which is facial. To check the facial nerve, this is on page 635. You're going to have the patient frown, have them smile, have them close their eyes tightly, and have them puff their cheeks. So that's how you would check for cranial nerve number 7, and you would say it's intact. So will you smile? Will you frown? Will you puff your cheeks? Then for cranial nerve number 12, cranial number 12 is hypoglossal, and you would simply have the patient stick their tongue out and inspect the tongue. You're seeing if there's any abnormal movements, if it's deviating from a certain side, or if they can just stick their tongue out. If they can stick their tongue out, there's no deviations or abnormal movements, then cranial nerve number 12, hypoglossal, will be intact. Then you're going to inspect the neck, and this is worth 8 points. First, you're going to inspect the trachea position, and if you look on page 260, it goes over this. Again, y'all have already been over these chapters, so I'm just going back and reviewing. So you would inspect the trachea. You would notice if it's midline. Is there any obvious pulsations? Can they do range of motion of the neck? So you would ask them, can you bend your neck forward? Can you bend your neck back? Can you bend your neck side to side to each shoulder? And can you bend your neck all the way around? If they can, range of motion is intact. You would check their cervical spine for alignment and make sure that it's aligned correctly. Then you would palpate the trachea. So you would palpate the trachea as on page 261. It talks about in range of motion. Then you're going to assess the thyroid. The thyroid is on page 263. The thyroid's really difficult to palpate, and it takes lots and lots of practice. But you really need to have them with a glass of water. So get a glass of water out and have it ready during your assessment. The posterior approach is the most common that we use for beginners, and it talks about that on page 263. To palpate, you move behind the patient. You ask the person to sit up straight and then them to bend their head slightly forward and to the right. And practice this on people. It will make it easier. This will relax that neck muscle. And then using your fingers on your left hand, push the trachea slightly to the right. Then curve your right fingers between the trachea and the sternomastoid muscle, retracting it slightly. Ask the person to take a sip of water. The thyroid will move up under your fingers with the trachea and the larynx as the person swallows. Reverse the procedure for the left side. Usually you cannot palpate a thyroid. That is normal. If they have a long, thin neck, sometimes you may feel the isthmus over the rings, but you should not palpate it. If you palpate it, it is usually because they have a goiter, and it shows you a picture of a goiter on page 263. So they have some kind of thyroid illness or disease. So that's how I want you to palpate it. You also can auscultate the thyroid for bruits at that time if you want to. Cranial nerve number 11 is spinal accessory. You would get behind the patient and ask them to shrug their shoulders. If they can shrug their shoulders with your hands on their shoulders against resistance, then cranial nerve number 11 spinal accessory is intact. To check the lymph nodes, you would go on page 261 to be reminded where those lymph nodes are, and you will need to know these and name them when you're doing them. So if you start with the ones in front of your ear, there is on page 261. If you'll put your hands there and follow along as we go along, it'll help. Those are your pre-auricular, so right in front of your ear, page 261, feeling there, pre-auricular. If you slide behind the ear, posterior auricular, or number 2. Go to the base of your skull, number 3, and feel occipital. And you're going, again, you're just using gentle pressure with your fingertips, and they should not feel pain. If they do, then there's something going on with that lymph node. Then you go to 4, submental, and that's right underneath your chin. So you would feel right under the chin area. 5 is submandibular, so you go along the mandibular mandible. So go along the mandible. 6 is tonsillar, right below the earlobes. It's also called jugulo-digastric, so you can call it jugulo-digastric, or you can call it tonsillar. 7 would be the superficial cervical if you slide back just a tad. 8, you would go down that muscle, and that is the deep cervical chain all the way down that muscle. 9, you go back in the V a little bit. That's your posterior cervical. And then have them bring their shoulders forward and lean over and go over the clavicle bone, which is your supraclavicular. So practice those on several people till you get used to those. You will have to do those, and you will have to name those. Last but not least, again, you're going to check the cervical spine, and you're going to be checking the concavity and convexity of the spine, and if there's any scoliosis present. So you would have to tell them to bend over as they're swimming into a pool and make sure there's no deviations. All right, that wraps it up for the mouth and the neck, Roman numerals 8 and 9. The next one that I will be doing will be going over the lungs and thorax and the breast and axilla. All right, if you have any questions or concerns, don't hesitate to let me know. Thank you very much.